while most of us may be focusing on summer fun right now, health officials are already working on a plan to prevent a repeat of last winter's tripledemic of respiratory illnesses.
The plan involves vaccines, and this year the CDC is recommending 3 of them, one for COVID, the flu, and a new one for RSV. This comes after last winter saw some 58,000 deaths from the flu during the peak season, while roughly 50,000 died from COVID between November 22 and March 2023, and 10,000 from RSV, which also saw more than double the number of hospitalizations. Health officials say the 3 shots will greatly help lower those numbers, but there are some concerns.
Let's bring in Dr. William Schaffner. He is a professor of infectious diseases at Vanderbilt University Medical Center. Dr. Schaffner, welcome. So how did these respiratory illnesses become so virulent last year?
Well, Elaine, what happened probably is that before then, we were all locked down, wearing masks, children staying home from school, and we reversed all that, right? We were protected from the viruses by all those lockdowns, and then we opened things up, took off our masks, sent the kids back to school, and the viruses had an opportunity to spread. And they did last year. They started early, they started vigorously, and there were 3 of those viruses active, those respiratory viruses, at the same time: flu, COVID, and this other virus that people are just hearing about, RSV.
Dr. Schaffner, when we talk about these 3, can you take all 3 vaccines at once, flu, COVID, and RSV?
Michael, I don't think too many people will want to do that. I will tell you that flu and COVID are well studied. They work well together. RSV and flu, it resulted in a somewhat diminished response on the flu side. So I think RSV probably ought to be taken alone, separate from the other 2.
Well, we know, doctor, that generally the vaccines are especially important for seniors and people with underlying health conditions. Are there some groups that should not get the shots, or at least not all 3 of them?
Well, so far, RSV is recommended with discussion with your doctor for people age 60 and older. So we can put RSV aside for that group. Other than that, I think COVID and influenza vaccine will be both widely recommended. We know influenza's vaccine is already recommended for everyone 6 months of age and older. And the recommendations for the new COVID booster that we anticipate this fall, they'll be coming soon. And they'll probably also be rather widely recommended.
And doctor, talking about COVID, do we have any information yet on how resistant the latest COVID mutation is?
Well, so far, fortunately, you see my fingers are crossed. These COVID variants that are showing up are all related to the Omicron family, and they should be covered by this new vaccine that is going to be available this fall.
Interesting. All right, Dr. Schaffner, while we have you here, the FDA has just given full approval for the Alzheimer's drug Leqembi, but there are concerns about the medication. What can you tell us about that?
Well, let's applaud first. This is an advance for Alzheimer's. This is an area in which we have waited for scientific breakthroughs. So it looks as though we have a medication that can at least slow down the progress of Alzheimer's. But on the other hand, we need to have some cautions. You can get an adverse effect of brain swelling, which is obviously not a good thing. And this medicine is not easy to receive. You'll need 2 infusions, IV infusions, every month. So let's see how it works out in practice. But in the beginning, applaud. We're moving in the right direction. Science is helping us combat Alzheimer's.
Cautious optimism it is. Dr. William Schaffner, doctor, always great to have you. Thank you.
My pleasure.